that recording? All right. Beforehand, I did send out to those that registered before just a copy of the slides and also to a couple folders that were zip files that had some of the attachments that I'm going to go over as well. You do not need to use these attachments. You can take them and make them your own if you want to. Really whatever works for the families that you serve. These are just ones that we use, we've used in the past, but again, it is completely up to you. There were a couple emails though that did bounce. I don't know if it has to do if it's a certain school district or a certain health department. I was not able to send it to everybody. I did get those bounce back. So if there is another way I can share the copy of the slides and those zip files with you, please you can put in the chat directly to me or send me an email, let me know. Just nice to have those, I think, as you go through or want to refer back. But I will share the recording too again with everybody after we are done today. All right. So I thank everybody for joining. If you could just put your name in the chat and whatever organization or school district agency you're with, I'd appreciate it. It'll just help me as I go through here. I am going to ask everybody to mute themselves if possible, just to help with feedback too. But other than that, we're going to get into it today. And I did this yesterday, so I can do it today. All right, perfect. All right, so in our 101 workshop today, we have a lot of new people that are new to vision screening, school nursing, whatever that may look like for your program. So I welcome you. And I thank you very much for all the work that you do. I know we all have responsibilities that a lot of times it seems like they just keep piling up. And you will learn that vision screenings, they're not required in Wisconsin, but they are extremely important for us. So as I get into this, I want to introduce myself. My name is Courtney Murphy. I am the Director of Community Health at Prevent Blindness Wisconsin, and I've been here for about 5 years now. It's been a great journey for me. I've learned a lot along the way and just how much vision really affects all areas of health and can really affect a child too as they try to grow and develop and become who they want to be one day. So a little bit about Prevent Blindness Wisconsin. We are a nonprofit organization and we are located actually in downtown Milwaukee, but we service the entire state of Wisconsin with preventative vision health services. Vision screenings really are that bread and butter program for us, but we really try to get out to awareness when it comes to vision health for all ages. Newborns to older adults, does not matter. We don't have that age limit there. And really what we're trying to do here is we can vision screen thousands of people throughout the state every year. That is a wonderful thing for us. But the thing that we really want to do is make sure people understand how to get to further vision care. That's going to be a big thing for us. We really want to make sure that that full cycle of care is able to be there for them and that they understand if their child is referred or they're referred, you know, they may now may not be.
Is that too loud out there?
Them to get to care. All right, let me see.
Let me know if she texts you, because she's got a finger stick.
I'm just going to mute everyone.
Yeah, so she should be coming in.
Lunch started just now.
Okay, I just want to check that I have everybody muted. I think I do. Okay. All right, so going on, so we are a full-time staff of 6. So the work that we do, we rely really heavily on our partners and our volunteers. So again, I thank you. I thank you for all the work that you do. DPI is a very big partner of ours. We do work with Louise Wilson quite a bit when it comes to getting information out to school nurses, and what that looks like for the school year as well. The Wisconsin Head Start Association is a partner of ours. We partner with different university programs and high school students, which we'll cover as we go through the vision screening workshop as well. So the work we do, we rely really heavily on our partners and our volunteers. A little bit of background of the past year that we've had. We were able to offer services and education to over 590,000 Wisconsinites throughout the state. Of those, 131,000 were those direct services. So that does include vision screenings, one-on-one case management. But like I said, all of that work is not possible without our partners out and about screening. And this is just a visual to give you where we are in the state. We are in all 72 counties. And getting into the need here. So why do we want to vision screen kids? The biggest thing here is Wisconsin is actually one of 9 states that does not require vision screenings for preschool or school age children. There is no mandate out there to vision screen. The state of Wisconsin does have a mandate. I use the word mandate loosely here. It is a recommendation for parents or caregivers to ensure their child has a vision screening and or an eye exam by December of their kindergarten year. So typically with that in the beginning of the school year, they may get a letter home that says we recommend if, for example, Courtney has never received a vision screening or an eye exam by December of their kindergarten year that they receive that. That is all we have in the state. However, the mandate rule for us, we kind of go back and forth of, do we want it mandated? Do we not want it mandated? With this, we really are able to connect with our partners and make sure we have that vision screening program in place. So the work that you do, again, I thank you. The need is out there. We have about 1 in 17 preschoolers and 1 in 4 school age children that has a vision problem. We are seeing that become more and more frequent. It used to be 1 in 20 preschoolers, and within the last 3 years, we've seen that change. A lot of it has to do with electronic device use, constant use with the near muscles, not being outside as much. We're in a changing world, and vision issues are becoming much more prominent in kids. A lot of times kids don't think the way they see is different than how anybody else sees. So that's why we vision screen and why we really promote vision screening often and vision screening early. So the first step of the vision screening program, 1, becoming aware of it, absolutely. But 2, we want you to become a certified vision screener. There's a lot of benefit in becoming a certified vision screener. All right, 1 person in the vision screening program, wherever a vision screening is taking place, there needs to be at least 1 certified person in the room. We want to make sure we're following proper protocol, making sure those screenings are accurate. So how do you gain certification? Well, certification is valid for 3 years. So after certification, you can go 3 years. We do ask you to recertify after the 3 years is up, though, because protocol may have changed. There may be new information out there, follow-up techniques, whatever it may include that we want you up to date on. So we do ask after the 3 years to recertify. So ways to become certified. 1, we typically offer live virtual trainings monthly when it comes to our team. We are seeing that's going to be shifting maybe a little bit more to every other month, depending with the new year. But that is an option. Another option that you can do is we have our children's vision screening training video coming out middle of November here. If there is an interest, please email me. I'll put you on the list. Once it's live and ready to go, I will send you the registration link, and it's an asynchronous format. So it's nice. You can do it on your own time. And all we ask of you after that is once you complete the video is to schedule a skills check with one of our staff. The skills check, it's a 30-minute virtual meeting where we go over the charts, protocol, answer any remaining questions you may have, or also to going over what follow-up may look like if you have a brand new screening program that you're new to. It's just a way for us to communicate after the video training is done. We do offer in-person trainings too. So if you're a school district, your agency is interested, we can schedule an in-person training as well. We just need a minimum of 10 people when it comes to travel for our staff. So there are 3 options to become certified. The next training we don't have set yet for live virtual. It should be coming up in December, but date and time is to be determined. But that should be upcoming for December if you're interested in the live virtual option. How long are our trainings? So length of training is about 2.5 hours. With this, the video itself, it's running about 1.5 hours long, and then you have the virtual skills check. Again, though, it is a 3-year certification. The certification, again, like I mentioned, I think is very valuable. We go through protocol for different age groups. We go through common signs and symptoms of a possible vision problem for kids. what does follow-up look like, different resources to vision care. It really is a nice, valuable tool for you to have and to go through that process. All right, so after becoming certified, this is how we're going to start our vision screening program. One, you need to choose the time of year you would like to conduct your vision screenings. Fall or spring are options. Some school districts like to do in the fall, some in the spring. Fall is recommended. We do recommend it from us as well, just so students have more opportunity to get connected to glasses or further care if there is a concern. It can help them in the classroom, beyond the classroom. However, I know a lot of things happen in the fall, a lot of testing happens in the fall, so you can do your vision screening program in spring. With this though, we do ask, if possible, try to avoid end of April, May, just because for those referred kids, it's a lot more difficult to do follow-up with them over the summer months. And we want to make sure that they're able to get connected to resources and care if they can. So one, you want to choose when you want to conduct your vision screenings. The second step we want to do is notify parents and caregivers. Prevent Blindness Wisconsin, we have an opt-out method. So with this, we typically send out an announcement. We work with schools that send out announcements either in Infinite Campus or via a school newsletter, stating that vision screenings will be occurring during the month of, for example, October, or during these set weeks coming up for your child. And if a parent or caregiver contacts you where they don't want their child to participate, that's fine. That's that opt-out method. Otherwise, if we don't hear, we assume that everybody can receive that vision screening for those set ages. If your school, though, requires permission slips, I'm going to show a couple of examples here. So this would be, we created a sample announcement. You can take this if you want to. It just kind of goes through, you can put this, like I said, in your newsletter, out in an email, whatever it may look like for your school or agency you serve. When the vision screening takes place, why it's important, and if there's any questions, where they can contact you at. So I did put this as an attachment in the email sent out. However, if you did not get that, let me know. We can try to find other methods to share that with you. And then also too, I did share, this is a permission slip that we've formed in the past too. Again, you can take this or adjust it as you want to. If you do permission slips though, you can only screen those children that receive, obviously, permission from their parent or caregiver for the screening. That's why we really like to go with the opt-out method, because a lot more students are able to be vision screened. If some students just forget to bring their sheet back or it's never signed, you can only vision screen those that you have permission for. All right. So really, it depends on your school, your agency, what is set in place for rules. But we typically go with the announcement. And then if you hear differently from parents of, I don't want my child to be vision screened, just not vision screening those children. All right, so after notifying parents, you want to notify teachers of the vision screening dates and times you choose. So we do get the question, what grades should I vision screen? So we go off of Bright Future guidelines. So what we recommend is vision screening 3, 4, 5, and 6-year-olds annually. All right, the critical growth period for the eyes is between the ages of 3 through 5. So we really want to prioritize those littles if you have them in your school, organization, whatever it may be. So we want to prioritize the littles first, so preschoolers. Then we typically see screenings occur about every other year, depending on capacity. So typically we see then after first grade, third grade, fifth grade, seventh grade, sophomore year, and senior year. All right. Again, we typically see those drop off about after fifth grade, just due to capacity. Also, too, as kids get older, they're more likely to verbalize if they can't see as clearly. And also, too, as they get older, we're finding they have glasses, they just don't want to wear them. So again, we really want to target those littles. If we can start the habit early of wearing glasses if they need them, it's a little bit of a better process for them. And for, your screening and all of the time it takes for you to do that as well. So recommendation, if you have littles, 3K, 4K, 5K, prioritize them first. And then if you do have first, third, fifth, we would if you have time, screening those, but making sure we get those littles in, just because the more serious vision concerns we want to catch when they're younger. Otherwise, it can be permanent vision loss. And if they're caught at an older age, a lot of times we can't gain that back. So prioritizing the grades you're going to screen, then you will need to notify the teachers again of the screening date and times and classrooms. So what we recommend is gather those class lists up. And what you can do is you can either record for the vision screening on the class lists themselves, or you can print off a vision screening document with the students' names and transfer them over to that document as well. What I'm getting at here is we have a sample sheet here. We typically use this for our childcare centers. It really depends on what you want to do. If you would rather go off the class list and do your own method of do a column for pass, do a column for refer, really is up to you. But this one is, we have the child's name, age, if they wear glasses, and as you can see, any comments you see during the vision screening, if they're a pass, refer, and which eye. So again, really depends on your method. If you want to go off the class list, we typically put P down next to their name if they're a pass, R or F for refer, and write down which eye. So we want to make sure those class lists are ready. I do recommend having a couple copies of class lists and then a master copy too, to put all of your results in for one, especially if you have multiple screening lines going on. All right, so once you choose your date, depending on the time, for first-time screeners, if it's just you, if it is university students or high school students helping you out, what I would do is I would average about 30 to 45 minutes per classroom. Now, obviously, as you get more comfortable with the process as they do, obviously it may go a little bit quicker. For our littles, it does take a little bit longer. It takes about, I would say, approximately 5 minutes per student, especially if they're 3 or 4 years old. Sometimes they may be nervous. They may start to cry. We've seen that. So we just want to make sure that that process is comfortable for them. 6 years and older, we really can get through the older kids a little bit more quickly, probably about 1 to 2 minutes per kid, especially as they get into 3rd and 5th grade as well. It's recommended for you to schedule more time per classroom, especially in the beginning stages here. But what I would do is, if you finish a classroom early, I would continue on with the next classroom, even if you're early, just because it can really help you with the flow of the vision screening instead of waiting 20 minutes. We just find that's a lot more helpful. So in the beginning, I would say average time 30 to 45 minutes per classroom. I would stick more to the 45-minute end of things until you're used to your process. All right, so for the vision screening, if possible, if you have assistance in your community, in your district, we can help with that. That's why we're here to help with that partnership building too. We have a lot of school nurses and school districts that actually utilize university students, high school students, volunteer vision screeners to help them with vision screenings throughout their program. So if you're interested, what we do is we reach out to them, train and certify them as certified vision screeners. They then can come in on your set screening dates and help you with vision screening your students. So if you have a lot of students, we can set that up. It's nice with university programs. We actually make it part of primarily their nursing clinical hours. For high school students, HOSA students are always looking for more hours out in the community as well. And with them, there typically is, with university, always that professor available as well to guide them through too. So if you are interested in this, please email me. We can talk through opportunities. There typically is always an interest by someone in that area or county that would be more than willing to help out and help you with screenings. The other thing I want to mention here too is having volunteers, if it's parents, teacher aides, be that runner during those classes that are being vision screened. So they can help assist with the flow of it. They can have runners from taking students to and from the classroom. I know it depends on the school itself, but some schools allow kids to go in the hallways. It just depends on attended. If the teacher sends them all down at once, you know, it just really depends on the school, also the teachers as well. Sometimes they like to send 2 kids at a time, but they can be that runner for the day to make it run smoothly. And they can review the shapes with our preschoolers too before we get into their screening if you're using the iCheck booklet as well. All right, so after setting up that aid, if possible, we want to choose your screening location. So space recommendations for this would be bright, even lighting, especially if we use our charts. If you have an instrument-based tool such as the Spot, the Plus Optics, obviously that's going to look a little bit different. We do like a little bit of a darker room to really pick up on the pupil size for the tool. But if you're using the charts, we do want a nice bright and even lighting. Trying to avoid a room with all windows that can really cause a lot of glare on the charts, or if you have blinds, pull them to cover up that glare from the outside. In a best case scenario, an empty classroom or the corner of a library typically are very good screening spots. Hallways are other options too if the classroom isn't available. We do recommend to avoid gyms if possible, just due to echoing and not being able to hear the student being vision screened as clearly. Also too, if there's the middle of gym class or lunch hour, it can be very distracting for them. So yes, we work with what we're given, absolutely, but a more quiet, out of the way location can really help with the process. Next, you're going to want to determine the number of screening lines you're going to run that day. Obviously, if you just send a couple of students down to your office to be screened and just do that process, that looks a little bit different. However, if you are set up in a classroom with aides or vision screeners to help you, we recommend about 2 to 3 screening lanes to be set up. I would not do more than 3. It can be a lot to control, a lot to maneuver. And for school-age students, we do like to rescreen them if they don't pass on the first go around, and they can get mixed up too with who was screened, who needs a rescreen. And also too, it can help control that noise level a lot. So I would recommend about 2 to 3 screening lanes. I typically don't like more than 3 screening lanes. Really is up to you, but that's my recommendation for that. We also too, when the screening's taking place, want to manage the number of students coming into the screening room. If possible, I really try to avoid not having the entire classroom go in. Again, noise is a big factor, but also too, it can limit distraction. So I recommend only bring kids in that are going to be screened at that moment. All right. As they get older, if their friend doesn't pass, they can start to make fun of them. They can cause distractions. We just don't want that in the screening room. So if they can wait out in the hallway, maybe with an aide or one of the screeners from the universities, and they send them in as kids are done, that seems to be the best method. Or put them on the exact opposite side of the room if it's a bigger room, but they do need to maintain that noise level. All right, so after we vision screen the students, we want to record the results. Each screening line, like I mentioned, should have a copy of the class list. If it's the attendance sheet, if it's the sheet that we have that you fill out, or an Excel document that you fill out, each line should have a copy of a class list to document the results per child. I recommend then having one master copy where you copy all of those results onto one, so you have that set copy and it's not a million copies everywhere. So when we record the students' results, we recommend sending home results forms after they're vision screened, and we primarily only send home those results forms to referred children. You can send them home if they're a pass, just to let them know that they passed. However, we typically just send the results form home if they do not pass. On the results form, I'm going to show you an example of one we use. A lot of our partners use this one, but the screening date should be listed. The screening results, whether they if they're referred, obviously, which eye, and which tool was used, whether it be a Sloan wall chart or the Spot Plus Optics for the littles. If you noticed any concerns, if Courtney was squinting during the screening, if you noticed a wandering eye, we really try to promote those that we train to write down as much detail as possible during the screening If they notice anything abnormal during it, we're finding parents and caregivers are more likely to take their child in if those observations are written down of, oh, squinting during the screening, instead of just the, your child didn't pass, the referral box is checked. If you have students who are absent the day of the vision screening, it's recommended that you vision screen them on a different day. Again, if there's a couple students, bringing them down to your office, trying to get them through during that time period, that's typically what we see being done, but we do want those absent kids to be screened if possible on a different day. This is just a sample of the results form we use. At the top here, we have the date. You can check the box on the screening tool used here, the child's name, if they wear glasses and if they had them with them, and then the results here, passed or did not pass. For children under 6, we just circle the right, left, or both eyes if they didn't pass. And then for those over 6 with the wall chart, we do write down their acuity score and any observations too, such as squinting or what have you here. Down here, this is a nice results form because we actually do get quite a bit of these back. We recommend they take this into the eye doctor office here in the instructions, and they actually send back results to us, and we can document and track that way as well. On the back side of this form, it is nice too, because it lists what should a parent do if their child didn't pass the screening, and it goes through different options for them if they have private insurance, Badger Care, no insurance, and also has our contact information as well. So all of this, the results form, I did send it on that email, but it can be found on our website too. I will show everybody we have a school nurse toolkit and other partnership toolkits too, if that interests you to download all of these resources. All right, so that's pretty much it for the vision screening program. When it comes to this, I want to emphasize vision screening protocol a little bit more here. It's extremely important for us to make sure we're following proper protocol for specific age groups. All of our protocol is set through our national office, and that is through the National Center for Children's Vision and Eye Health. So for preschoolers, approved protocol is monocular measure of visual acuity, which is the eye check booklet, okay, with the Leia symbols, or instrument-based screening tools, which is the plus optics or spot screening device. For school age, the only approved screening method for school age is going to be monocular measure of visual acuity with the Sloan wall chart with the appropriate occluders. There is no evidence, no scientific evidence behind instrument-based tools being an effective screening method on school-age students. They formed the spot, the plus optics, they designed that to detect for amblyopic risk factors, and that's the main purpose of our preschool vision screening. For our school age vision screening, we're really looking at the detection more so for refractive errors, and we can find that the device can miss referrals because it's not designed to pick up on those refractive errors like it is for the littles with amblyopic risk factors. There were questions out there on, can I use the tool on everybody? It is not approved for everybody. Tools, Spot plus Optics are only approved, or SureSight if you use that, for 3, 4, and 5-year-olds. Anybody older should be using the Sloan wall chart. When it comes to ordering the vision screening charts, we do have a procedure that you can follow for this. You typically used to order them directly through our office. We did change that probably about 2 years ago, and now you order directly through school health. I do have an instruction sheet that I shared, but it is on our website as well on how to go through that process, but it is in the slides here. You go directly to the school health website, and I did list out if you're using charts, if you just need a 3-year-old booklet, what the item number is. Essentially, you put the item number in the search bar, it brings it up, and you can add it into your cart and check out. It's very simple, very streamlined, a little bit quicker too from sending it into us and then us sending it to you in the mail as well. So I did list all the eye check booklets. If you need extra occluder glasses, I listed those item numbers. Each of those item numbers differs with the different characters on them, such as the horses, parrots, butterflies. For preschool screening devices for Spot Plus Optics, if you're interested in purchasing those, you can go directly through the manufacturer with those. Spot is Welch Allen. And I did provide links to those as well. Obviously a little bit more pricey than the charts, but you would go directly through the manufacturer if you are interested in those. And then for school age, the Sloan wall chart item number is on here. If you need more occluder paddles, that one is on here as well. All right, so then getting into follow-up. So if a child does not pass their vision screening, follow-up is a required component of our vision screening program. So essentially, if a child doesn't pass their vision screening, we want to make sure we're offering assistance resources to those families to make sure they're able to get in and be seen. So with follow-up, it really depends on what works for the families you serve. What we do with follow-up is going through the steps to make an eye doctor appointment based on vision coverage, the different follow-up attempts you can try out with your families, but also too, if they report back that they received an eye exam, for you to track that and what those results were as well. So follow-up timeline. Prevent Blindness Wisconsin, we recommend after sending the results letter home or results form home after the screening takes place, a 3-hit follow-up approach. So essentially, the second touch that we make after the results form goes home is about 1 month after the screening. Now, this can be a variety of what you want to attempt to do. It can be a phone call. It can be mentioning it to the teacher. Can they mention it at teacher conferences? It can be an email home to parents or caregivers. It can be a letter if you want to send a letter home with the child. Any type of attempt to see if they made an appointment, and if not, what are those barriers? The third touch that we do is about approximately 3 months after the screening. With this, you can do, if you have text messaging systems, you can send out text messages. Again, a phone call, maybe it's a push notification through Infinite Campus, any attempt that you find effective. And then the last follow-up attempt is about 5 months after the vision screening takes place, an email, text message. Really, that last attempt we promote, do what is most effective for what you're finding with the families you serve. It may be a letter, it may be an email, it may be working through the teacher. Really, it depends on what works for you and your students. Again, if they are going on summer break, really trying to get that in beforehand, or trying to figure out what the barrier is to care. We really just want to make sure that they're able to have, if they need glasses or treatment, before that next school year begins. This is a sample of a follow-up letter that we've sent home. So again, you can use this template if you want to. I did share this in the email. Our office came up with text messaging systems as well, if you want to use those messages, if you have those. We have a decision tree too on how to make an eye doctor appointment that we've made as well. If they have Badger Care, if they have private insurance, no insurance, just to give them a little bit more of a graphic to navigate the system as well. So when it comes to reporting your numbers, we are a self-reporting system. We do ask, as you are certified, as you are out vision screening, as that partnership, to report your screening numbers at the end of our fiscal year. You can report your numbers anytime you want. If you finish your screenings in the beginning right away by November, you can send them into our office, that's fine. If you want to wait until you do a little bit of follow-up work, that's fine. Or if your screenings don't happen until spring, we typically do our pushes out for reporting numbers between February and March of every year. Our fiscal year runs from April 1st to March 31st. So it's a way for us to get that data in, really report out on it, and look for any major findings and see if we need to adjust programming to help families and partners a little bit more. When you submit your screening numbers, you can email them directly to me, you can fax them, you can mail them. This is a sample of our reporting form. Again, you may have a different one for your school or agency, but you can see it lists the grade, number screened, number referred. You would put your information at the top of what you used as well. And then this is the back side. If you have follow-up results or know a child went in, if they wear glasses, you can document that, or you know that 5 were diagnosed with myopia in 5K. Essentially, it's just putting the number down. We don't need any contact information or any identifiers of the student either. And this is all located. We have a PDF version as well as an Excel version. If you just want to plug them in via Excel instead of writing them down, that's fine too. All on our website, again, shared in the email as well. All of this information though too, if you go on our website under our resources tab, there is a link for vision screening toolkits. We do have a school nurse toolkit dedicated obviously to school nurses, but also other partners. So if you're a childcare provider, if you're Head Start, community volunteer, we have all of the resources I just covered in there for you to print off, to use. Happy Feet, if you're vision screening and using the Happy Feet, for you to print off and use. I do want to get into as well just a little bit about vision care and vision care resources. So we do get questions on what covers what. If a student has Badger Care or Medicaid, they should cover an eye exam and a pair of glasses every year, and up to 1 replacement pair of glasses as well if the child loses it or breaks it. So Badger Care does have that coverage. What we're finding though is some families don't know their HMO on Badger Care. And what our office did is we actually put together a worksheet on how to make an eye doctor appointment with Medicaid. And it walks them through the steps of how to figure out their HMO. Once they know their HMO, how to find a clinic in the area that accepts their HMO, down to writing down their appointment date and time. So if you are interested in that, let me know. I can send it out to you. It is on our website too, under our resources tab on how to make an eye doctor appointment. It's a really nice resource. It really takes them through, call this number, push this number to get to the operator. And hopefully we'll walk them through not just making a vision appointment, but if they don't know their HMO, what's the likelihood that they're able to get in for primary care? So it's not just vision now, we're looking at, all areas of health to help them get into care. If you have a student that doesn't have vision coverage though, is uninsured, Prevent Blindness Wisconsin, we do have a program through VSP Vision Care. It is a voucher program for children and adults. And this covers a pair of glasses and an eye exam every 12 months as long as they're eligible. It does also cover a replacement pair of glasses, say if they exceeded all their benefits with Medicaid and they need another pair of glasses, we have a glasses only program they can apply for as well. We just have some specific criteria depending on the program. So the eye exam and glasses program, they do have to be at or below 200% of the federal poverty level. If you have a student though, we go off of as well for kids, if they qualify for free or reduced school lunch, that is just fine as well. If you know that, you typically just check a box on the application and that's all we need to know. Obviously they can't have Medicaid, or if they've exhausted the resources, that does look a little bit different, and they can use this every 12 months. If it's less than 12 months, we do ask them, they have to wait until that 12 months is up. I do know too, through NASN, you do have access to these vouchers as well. So you can apply through PBW. All of our applications are located on our website. I did include them in the email too, though, English and Spanish. Otherwise, though, I know NASN does have these certificates available as well for you. And I did do kind of the breadcrumbs on how to access those. So logging in, getting into your membership, and being able to complete that form for those certificates as well for your students. For the eyeglasses only, again, it's very similar criteria. The eyeglass prescription just can't be more than 12 months old. If it is, obviously we want them to use their other benefits, go in for the eye exam, and then use their benefits that way. The other thing I want to put out there too is we do have a lot of resources out there, a lot of parent resources. So we go over common vision problems. I mentioned before, screen time is a huge topic we're trying to cover now for parents, school nurses, school staff, teachers. just because the effects are very, very great now. And we don't see any decrease in those at all in the coming years. Myopia rates are expected to increase like crazy. Kids are not getting outside as much. So we do have fact sheets on screen time in the eyes. We have a Kids Take It Outside campaign. It's a public awareness campaign on why kids should get outside and take breaks from the screens. So just awareness tools out there, because we are seeing, as the results forms come in for each student, if they get in, that myopia box is likely checked. And that is a condition that we cannot reverse back. So we just want to make sure people are educated and aware of those effects. We also too have county eye care provider guides. So walking through different counties, different optical clinics in those counties, if they accept Medicaid, Medicare, have a translator, see kids 3 to 5. So those are all located under our resources tab on how to make an eye doctor appointment. And like I said, that flow chart as well is very helpful. Also too, we do have vision and eye health curriculum for teachers. So the curriculum is 3K and 4K, also 5K and up to 5th grade. It includes all the lesson plans that they may need to. And with this, we really form this to have the teachers implement this in the classroom before the vision screenings occur, especially for the littles, to get them a little bit more comfortable reviewing the shapes that they may see, and that this is going to be coming up for them. It does meet Common Core Health and English standards. It's all free to download. If you're interested, email me. Otherwise, I did put the zip file for all of the curriculums in that email sent out yesterday too. And lastly here with success stories. Our success stories, we really try to promote them. So if you know a child got into care after your vision screening, we actually have success story forms on our website. Again, included in the email too, though, that we ask, if you know a child went in, to share that with the family. Sometimes they send in a picture too. It's just really nice to share the good work that you do, to see the good work. Like I said, you're not required to do this, and we're very thankful that you take the time to do this for your students, because many students would go missed. Many students would go with a vision problem and it not be corrected maybe for years to come. So again, we're just very grateful for that. And if they do send in a success story, we actually send them a book home as a nice incentive and a thank you for sharing their journey and story. All right, so that is everything I have. Just a little bit of an overview of what that process looks like. If there's any questions, I can stay on to answer them. We ended about 15 minutes early, but it really is that general overview of how to start your program. What does that look like? If you're running into barriers to care, how can we work together for that? But, starting the screening program, it can be overwhelming. So if there is any interest, if there's interest in doing outreach for forming partnerships to have university students come in and help you screen, please let me know. It's a very common model we're doing now. You have a lot going on in your plate. So yeah, if there's any questions, please feel free. Otherwise too, you could shoot me an email. Can shoot you those resources over too. I apologize. Some of them didn't go through, some of them bounced. I'm guessing maybe it's because it's an outside agency, but a copy of the slides too, but I can certainly share the recording with everybody as well.